Major support for Carolina Business Review is provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. NOVANT Health, bringing you world-class technology, clinicians, and care when and where you need it. And Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
Opioids, healthcare, infrastructure, and politics. Add a little dash of ethics reform and we might have something really cooking when it comes to dialogue this week. Welcome again, and thank you so much for supporting the longest running and the most widely watched source of Carolina business and public policy here in our region. I am Chris William, and on this edition, we will attempt to distill those issues from the everyday hype, and later on, North Carolina's Health and Human Services Secretary, Dr. Mandy Cohen.
Gratefully acknowledging support by Blue Cross Blue Shield of South Carolina. Please visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. BARINGS, a leading global asset management firm dedicated to meeting the evolving investment and capital needs of its clients. Learn more at barings.com. On this edition of Carolina Business Review, Christine Michaels from the Greater Fayetteville Chamber, Rob Youngblood of the York County Regional Chamber of Commerce, and special guest, Mandy Cohen M.D., North Carolina Health and Human Services Secretary.
Welcome again to our program. Rob, Christine, good to have you both here.
Thank you.
Great to be here.
Let's, I want to ask this question, and I don't want it to sound cynical or pessimistic. It's not. But there is so much hype, Rob, and Christine, please answer this as well. There's so much hype about Amazon, and HQ2 is what the project's called. You know, a lot of times a relocation of this size or a headquarters seeking of this size would be, there'd be a code word and it'd be very covert until it broke out into the open. Amazon just flung the gates wide open and says, we're looking for a place to go. Right. All offers are being accepted to some degree. How would you handicap the opportunity that the Carolinas might be in the top 10?
I don't know quite how you set that handicap, but I'd say our area here, the Charlotte region, has a very good chance of that, and I don't have any inside information, and I'm not sharing things that anyone else would know, but there are a lot of different opinions about Amazon, and I think it's a great company. It's amazing that you can go online or call an order and have things delivered in a matter of hours, and that does affect some of our small business people, but obviously this is a highly sought after opportunity for our communities, and I think whether we get it or not, the interesting and the pleasing thing about this is to see how our organizations and agencies throughout the entire region are working together to bring it here for the good of the entire region. And I think it's a great regional effort, and the fact that we're communicating, Rock Hill officials are communicating with our county officials, and our county officials and Rock Hill officials are communicating with those elsewhere in the region, and I think that's a very positive sign.
Christine, in a community like Fayetteville, you know, your single largest industry there is around the base, around the air base. And that might be the case if Amazon chose a spot in any town, really, it doesn't have to be in the Carolinas. How does a town, and you've been doing it now for a while, and your predecessors, how does a town manage such a huge single-minded business that comes into a community and reverberates and really would end up controlling the community? So if Amazon did choose a place, how would this county digest it, or how would this community digest it?
Well, I think you have to have a working relationship with the workforce development folks, and they can put in programs to take advantage of the workforce you have. Because we know, for example, in Fayetteville, we have a lot of highly trained, highly skilled people that are leaving that Army post and going back into the community, and leaving Pope Army Airfield and going back into the community. And their children, and other people in the area are going to be able to take advantage of that. So I think it is able to be absorbed in a community where you have that transition, where you have educational institutions and people looking for those kinds of jobs. I think we can handle it, and I think we have a good shot. I'm going to be optimistic here.
Yeah. Okay. Good. I like your sense of style there. Rob, let's talk to you about something in South Carolina, and that is SCANA, South Carolina Electric and Gas. This is not a new issue. This is not a new problem. They closed down the nuclear project that they have, and it's become this real albatross around everyone's neck here.
Right.
What's the best way forward on this?
Well, let me say, well, we didn't discuss that earlier, so I didn't have a chance
to think about
figure out a politically
that wasn't by
answer.
design, by the way.
Yeah, well, thank you for that. And of course, I think it, for full disclosure too, that those agencies aren't, well, York County, or the county that I represent, is not affected by those directly. Of course they do, because they're in our state and we're all South Carolinians. But I think that's now in the hands of our legislature, and it's unfortunate that this has happened, but it has, and we're hopeful that our legislative officials will find, with the officials of those agencies, will find the best way to deal with that, and to not overtax or overburden the taxpayers and, of course, the businesses that are affected by this.
Yeah, I suspect it's probably going to go on to find a solution. It's going to take a while to get to that, maybe even years. Fairly new to Fayetteville, fairly new to North Carolina for you, Christine. What has been the biggest single issue that you think that not just Fayetteville, but that part of North Carolina needs to handle?
Well, I think it's how you work with having a large military installation. And you're right, I've only been in Fayetteville and in North Carolina, for that matter, for 6 months. But what we're finding is there may be a perceptual barrier between community and military installation. And we are working very hard as a chamber to build those relationships. We're actually doing a luncheon series on how do you do business with Fort Bragg. And so we're finding that that's helping our small businesses being able to take advantage of what's right in our backyard and realize the economic impact of it personally for them.
Mm-hmm. Are there a lot of aha moments around that?
Actually, yes. We had a room full of people last month who were like, I didn't even realize that this could be done. And so now they can take advantage of it. And quite often it's just asking that command, hey, can you give a briefing to us? And they're more than willing to do that. And then you see those relationships start to form.
Rob, you get the last question before we bring our guests out. Business leaders in York, Chester, Lancaster counties say that they hold. Chambers have done, and I'm sure you've been part of this, have done these listening tours. These business leaders say one of the biggest things that they're concerned about is the infrastructure improvements that are going on. Is that, I'm surprised that hasn't been alleviated, I think, is the question here somehow, by the fact that South Carolina has really become pretty progressive in the gas tax and also deploying that money in infrastructure and transportation. Do you feel like that will be handled that way? I
do, and of course the gas tax was just passed this past session, so that has not had time to take effect or to show really any significant changes. But I think it will over time. And there's, even though a substantial gas tax was approved, that still it's really still just a little bit. It's a lot more than we've had. $600 million a year is a lot more we've had, but still will take time to figure out where and how to apply that. And the other thing that York County has that we're fortunate to have, and we're in the middle of now, is re-upping our 4th campaign for our Pennies for Progress program, which is our county-wide roads improvement program. That'll be voted on soon, and that will mean, hopefully, as passed, at $278 million extra to continue our work and planning for our major corridors and routes in York County. You know,
I will say, and it's not to be an accolade, but that Pennies for Progress really led the way. You talk about the Charlotte, Rock Hill, Gastonia region. That really led the way in the expansion of I-77 way before Charlotte and North Carolina did that. South Carolina had widened that road substantially into Charlotte, and that was quite an example for North Carolina transportation to model. So nice job.
Thank you. And in addition to the monies approved for that, it also allows us to leverage some additional funds from the state to do things like that, even though it was not a direct pennies program.
Yeah, thanks for bringing that back up. We're going to bring our guest out in just a second. Next week on this program, they are the second largest, get your head around this, the second largest credit union in this country, and it's called the State Employee Credit Union. Mike Lord is the CEO, following Jim Blaine, the longtime CEO. Mike Lord seems to be cut from the same cloth. He will be our guest on the show. And then also the majority leader in the South Carolina Senate, named Shane Massey, will be joining us on a program in just a few weeks. Hope you join us for that. You know, sometimes it takes an outsider to see things much more clearly than even the most objective insiders can. Our guest may very well fit that mold. With deep experience in the nation's capital as the former director of the Centers for Medicare and Medicaid Services, also known as CMS, she now directs one of North Carolina's most critical and largest impact agencies, Health and Human Services. We welcome the Honorable Dr. Mandy Cohen, Secretary of North Carolina HHS. Madam Secretary, welcome.
Thank you for having me. Great to be here.
Dr. Cohen, you're coming from D.C., you've got this national purview, and now you're on the ground in North Carolina, at least since the beginning of the year. What's job one for you?
Well, it's definitely to improve the health and well-being of the folks here in North Carolina. I've been privileged to travel the state, hear from a lot of folks, and see some of their struggles. I think there are a lot of great resources here, whether it's our great doctors and health institutions, our great public health departments, but folks are struggling, whether it's to care for an elderly parent, or fight their own addiction, or to even keep and find a good job. And so we're focused on a number of things, but really three at its core. One is fighting the opioid crisis. It's really taken hold here, unfortunately, in North Carolina, and there's much more we can do. Second is building a strong and efficient Medicaid program. We're about to undergo a pretty big change, but I think it's a really big opportunity as well. And then third is to focus on the kids here in North Carolina, and particularly on that birth, or frankly prenatal, until 5. It's such an important time in life to invest and make sure that no matter what zip code you're here in North Carolina, that you're getting off to that best start in life.
And I want to drill down on all three of those and certainly give our panelists, and let me start with the third one, and that is the kids. So often, you know, it's been said that children aren't named in the Constitution. They don't really have any rights, so many of us have to be advocates for it. Have you found that it is hard, not hard, that's not the right way to say it, Secretary Cohen, but how do you make sure that kids get the same light of day and the same notice that all the opioids, the Medicaid, the Medicare, how do you make sure that you push them to the front of the line?
Well, luckily, I've had a lot of other folks doing that work well before I joined here in North Carolina. I think there's tremendous infrastructure amongst the advocacy community that's focused on children and early childhood education and health. And I'll say my boss, the Governor Cooper, this is one of his top issues. He's very focused on it. So I think we're shining the light on it. And I think this isn't a partisan issue. I think both sides of the aisle recognize that investment in our kids here in North Carolina is so important, not only for making sure they have good third grade reading levels, but good graduation rates and are ready to enter the workforce. We're a growing state, which is fantastic, and we want to make sure that the workforce is there. And investing now in someone's health at age 3, age 4, making sure that they're ready for school. But this is also where lifelong health patterns get established. And so we want to make sure that kids are healthy from the beginning. And, you know, with the opioid crisis, our kids are unfortunately getting exposed to trauma early in life, and we need to really be thinking about that head on.
Rob, question?
It's often said, or at least certainly is in Chamber of Commerce circles, that the only great communities are ones that have great businesses and great business communities as part of them. And I agree that that's certainly true, and I think you would agree with me. We would say that either way.
We would.
But I think the other part of the equation is the health and human services. On one hand, the economic, and they're closely tied, but the economic strength of a community versus the other. And it's the reason that we strongly support through our staff campaign, the United Way, because I feel like it helps so much on the other side of the equation of having a economic healthy community as well as healthy otherwise. How do you see the role as businesses in that equation or in that effort?
Yes, well, I want to fully agree that without focusing fundamentally on health, you can't have your workers be productive and get them making sure that businesses can thrive and succeed. And so we are very focused on how do we improve overall health for folks. So there's a couple. The investment in early childhood health and education, really important. We've been partnering with some of the biggest businesses here in North Carolina because they know there's a return on investment. They want to see that investment made. But I'd also say the ability for folks to access care is so important to their health. That means having an insurance card and then having somewhere to use that insurance card. And so that means thinking about North Carolina is a very rural state, thinking about our rural areas and making sure that our rural hospitals are able to keep their doors open. And again, that all goes back to how many folks have insurance cards. And I think we all know that. I think there's mechanisms that we can use to move that forward. And it doesn't have to be a partisan issue. This is really about investing in businesses, investing in the health of both of our states so that we can reach all of our full potential.
Great. Thanks.
Christine?
Well, the question of opioid abuse just came up at a candidate forum that we hosted this week. And our candidates were trying to give their answers on some potential solutions. So I'm just curious, I want to run a couple by you.
Sure.
One of the suggestions was a better monitoring system of prescriptions that are being written. And then the second was writing smaller prescriptions. In other words, instead of a 90-day supply, you get maybe a 15-day supply. And the point was that if I'm a parent and I'm prescribed a certain drug, I'm going to know, if I only have 15 pills, I'm going to know if someone in that household, if a couple are disappearing. And they thought that would be a good monitoring system. I know you've worked some on putting those systems in place. What kinds of things could we expect at the state level for that?
Well, so I think folks have been seeing a lot in the news about the opioid crisis. It is unfortunately, we are at a crisis point, and there is no one solution, right? There is no one solution that will turn this tide. But I do want to talk about a couple of them. I think those are good solutions. What I would say is we're doing them, but it's not enough. We already have a monitoring system, a computer monitoring system, where doctors can go in and see who's gotten a prescription in the past. We need more doctors to use that. There's been legislation that was just passed in 18 months requiring everyone to use that system. Second, we have made changes even in our Medicaid program to limit the number of days of an opioid that someone could prescribe on a first use for pain. And again, it's really also about doctors like myself adhering to good guidelines and good practices on when we were writing those prescriptions. It's very much started with our prescription pad often, but there's more. We have to think about prevention. We have to think about the flow of those illicit drugs, because now our deaths are really from heroin and fentanyl. But importantly, when you think about treating folks who have addiction, it's really important to remember that addiction is a chronic disease. Like diabetes is a chronic disease or high blood pressure is a chronic disease. Addiction is a chronic disease. And so this isn't something where we can treat it for 30 days and we're done.
Right.
And so we have to fundamentally have a different solution. Grant money is not going to get us there, because Band-Aids are just going to be a small part. Have to get people access to insurance coverage, sort of going back to that earlier point. Improving access to insurance coverage will really allow for that ongoing treatment and recovery that we're going to need to fight this for years to come. And this is a marathon, and it will
and I
require
think
that.
Rob is right that if our businesses are healthy and can provide that coverage to employees, and we see that they're having that access now, hopefully that solves a piece of it anyway.
That's right.
So you've got, there was some state statistic from North Carolina, from HHS, that said unintentional deaths from opioids is almost 1,200.
Yeah. Higher than that. Yeah.
So how do you tweeze out, Secretary Cohen, how do you tweeze out unintentional and intentional deaths? And what is the total impact annually? What's the morbidity annually?
Yeah. So in 2016, we saw more than 1,300 deaths from opioids. Add that to the 13,000 times that our EMS workers administered the reversal of an overdose naloxone. So 13,000 times they brought someone back to life that may have died otherwise if they didn't have access to that naloxone. So this is a constant issue that we're seeing our first responders need to deal with, our emergency rooms need to deal with, and it's really straining our healthcare system at all points. And it's straining other parts of my department. Our foster care program has never been as large as it is, largely because of the opioid crisis. That's why it's going to need a comprehensive effort. We launched this statewide action program. The governor has taken a national leadership role. He sits on President Trump's opioid commission. He's actually in D.C. today meeting with that commission. And they have some particular recommendations about declaring a national emergency around it, because it's not just here in North Carolina or even in South Carolina. It's really gripping the nation, and we need a very comprehensive effort. We're doing all we can, and we need every tool in our toolbox, and that's why I don't want to leave any stone unturned here, whether it's prevention, working on the illicit drugs, and again, that access to insurance coverage is really an important
Is that, you know, it almost sounds like this is my word, Your Honor, but you're frenetic about it. Is there an inflection point that is almost frustrating you to the point if we fix this one thing, and I know it's much more than that, but if we could get this one thing clicked and in place, it would go a long way in taking the heat off this opioid issue?
There's no silver bullet for any of this. This is hard. We got to this place over 25 years, specifically with the opioid epidemic, but we will be so much better able to turn the tide here if we're able to have more folks with access to insurance coverage. That means they can access treatment and ongoing recovery service for a long period of time. Because like I said, this isn't about being able to treat something in 30 days and being done. They need a long-term access to an insurance card so they get off of those medicines and then can stay off. And that's really what we're focused on. So the most important thing for me that I am focused on is seeing how we can get folks more access to insurance. And I think folks know that there is an ability to expand what we are able to do through our Medicaid program. I'm disappointed that it has gotten into a partisan place. I think that there are ways to work across the aisle. We've had 4 members of our Republican caucus in a House here in North Carolina put forward a proposal on how this could go forward, and look forward to ongoing dialogue with members of the General Assembly, because we want the same thing. We want to both fight the opioid crisis. We want our state to be healthier. We want our folks to get back, to work, to be productive. And frankly, we can look at states like Indiana, where our current vice president did use the Medicaid program to help the opioid crisis, or Governor Kasich, who also ran for president, also used the Medicaid program and expanded insurance access to fight the opioid. So we have real data and real evidence about the importance of that. And I look forward to the dialogue. And I really do think that there is a North Carolina solution to both the opioid crisis and insurance coverage.
We have about 2 minutes, Rob.
I guess, very quickly, you said it just now about this not only affects lives and families, but productivity and workforce development. And I guess that's another reason that businesses are supporting the efforts to combat this crisis. Anything else that are being done with the education department or other? I assume several other agencies are working with you in
Absolutely.
this effort.
On the opioid crisis, it's been a real team effort, and I'll say everyone coming together has been critical, whether they're in the law enforcement community or the education community or in healthcare or the business community. It's been a tremendous, and it will take all of those partners together to turn this tide. So,
Christine, we just have a couple of minutes left, so let me wrap it up with something. There is, when it comes to negotiating rates for payers or insurance companies with providers, also hospitals, the language has gotten pretty acute, and it's gotten really much more debative, but it's gotten oppositional. There was a missive that came out of Mission Healthcare from Dr. Ron Paulus about Blue Cross Blue Shield being unethical and bullying. And that's become more normal to hear now in public dialogue. Can HHS play some honest broker mediator around hospitals and insurance companies now as we all try to bang through this new reality that we have, and we have less than a minute.
Yeah, well, healthcare is going through a lot of transition, and I know organizations are trying to transform, want to be paid in a different way. I know insurance companies want to pay folks in different ways, so they're going through a lot of changes, and you're seeing some of that friction play out. We want to be at the table to help facilitate that, and to make sure, one, we're aligned, that we're all moving in that same direction, because we need to get more value out of every dollar we spend. That is not a partisan issue. That is reality. We know resources are tight, and so we want to all be moving toward the place where we get better quality, that we are smarter with our dollars that we're spending. We get more of that value, and I think that's where everyone's trying to head. And it's a little bit of that friction, and I hope to be at the table to help facilitate that, and frankly align so we can all move in that direction.
Well, we all hope you will be, and thanks for being on the program. Please come back. We left so much untalked about and discussed.
I'd love to.
Okay.
Thank you, Chris.
Good to have you here. Welcome.
Thanks for having
me. Good to see you. Christine, also good to have you here. Thanks for being here.
Thank
Rob,
you very
nice
much.
to see you.
It's been a pleasure. Thank you.
Until next week, I'm Chris William. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, BARINGS, Grant Thornton, NOVANT Health, Sunoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.